Hello, Peterson Health family, Kerrville community, and the Hill Country region. My name is Cory Edmondson, President and CEO of Peterson Health. Our fiscal year just ended June 30th. I'd like to share with you what your hospital accomplished. Let's start by recognizing our journey through our strategic focus areas. First is team, and it's all about creating an exceptional environment and leadership and a team so our staff can thrive. It's all about culture. Creating a strong culture of engagement is critical to our success. When we surveyed our team, the overall results came back very positive, with an overall national ranking that put us in the top 13% of hospitals in the nation. This was affirmed by our recent award from Modern Healthcare as one of the best places to work in healthcare. This was our second year in a row to win that. If you want to hear more about our staff and how they feel about Peterson, go to our website and find out more on our careers page. Talking about our team and our staff, which includes physicians and volunteers and our board members, I'd like to thank our two new board members this past year, Otto Schwelthelm and Mary Liz Eastland, for their involvement. They helped us navigate one of the toughest years in healthcare. And let me give a shout out to our Employee of the Year, Valerie Bond, and our Exceptional Leader of the Year, Kevin LeGrone, Nurse of the Year, Lisa King, and our Doctor of the Year, Dr. Paul Gravel. All of these people were great and provided excellent leadership in our organization. Our second strategic focus area is exceptional care, and that's all about creating a place that provides world-class safety, quality, and patient experience. And how do we do this? It's about achieving certifications and accreditation. For example, our joint replacement accreditation, our acute stroke ready recertification that we achieved, our trauma level 4 designation. Instead of being surveyed every 3 years, we've chosen to be surveyed annually. Also, awards given to us. The Women's Choice Awards for safety, patient experience, and orthopedics and stroke. Additionally, the patient results from our surveys acknowledge that we're in the top 10% of hospitals nationally in areas like the emergency department and our hospice care, and even in the top 15% for physician practices and those who are affiliated with our Peterson Medical Associates. We achieved the Bill Ashton Quality Award from the Texas Hospital Association. In order to continue to keep up with our exceptional environment, our board approves capital dollars for technology and facilities. For example, they approved $3.4 million for a new MRI and CT scanner. The board also approved a new surgical robot for improved recovery time for post-surgery. For women's services, we purchased new fetal monitoring equipment. Our cardiology service line continues to excel not only with our doctors, but also with our new technology and equipment that we purchase. Our third area of strategic focus is growth. This is about deliberate progress. Our growth comes from the fact that the Hill Country is choosing Peterson for care. We are the hub for healthcare. Our growth created a need to expand our facilities. Through philanthropic support, we wrapped up our Today, Tomorrow, and Always campaign by exceeding our goal of raising $15 million, and we raised $20.2 million. I was overwhelmed by the philanthropic support our community gave us. It was incredible, and we're thankful for that. So I'm excited to announce that in January, we're going to break ground on our Amanda and J. David Williams Surgery Center. This will be a state-of-the-art facility providing technology, space, and resources for exceptional outpatient surgical care. When we are finished with that project, we'll renovate our PV House Ambulatory Care Center to expand existing services in that building, the physical therapy department, imaging as examples. We're growing regionally too. We're not just a local community hospital, we're a regional provider. In March, we expanded care to the Fredericksburg region for primary care. The community reached out to us and was seeking our services. There was an opportunity and we placed Dr. Barecki there. The community has fully supported us and we're thankful. Our deliberate growth has come from our ability to successfully recruit physicians as well. That includes true primary care doctors and 7 to 8 different subspecialty doctors. We're fortunate to have the subspecialty care here in Kerrville that we do. When the Peterson family started the hospital back in 1949, their objective was to provide care right here in the Hill Country. In fact, their statement was, there's no reason people need to travel to San Antonio or elsewhere for healthcare. We at Peterson are trying to embody that objective today by adding new service lines and technology and doctors to our community. This past year, our growth also came from a variety of areas. And to give you an example, we had one of our busiest years delivering babies. That was rewarding and exciting. In fact, our growth was like 15%. Surgical procedures were up by 10%, as well as our rehabilitation services. And one staggering area that overwhelmed us when we looked at the data was pain management. Our pain management service line with Dr. Jennifer Arian was up 62%. Dr. Arian is working hard, and patients in this community are appreciating what she's doing. Our fourth strategic focus area is stewardship of sustainability. And this is about our ability to be financially and operationally efficient along with making informed decisions. We must be good stewards of our resources to maintain our ability to be independent, a nonprofit community hospital. We provide roughly $49 to $50 million in charity and bad debt. And to give you an example, for us to continue to do that, $19 million was given in charity care. And that's for those patients who truly can't afford care. And for bad debt, it was $31 million. And that's for those people who get care at Peterson Health and choose not to pay but can't afford to pay. Those are in charges. And just imagine, if people paid their bills, what else we could do for our community. It's no secret, hospitals have been struggling nationwide financially. Many are in jeopardy of closing while others are shuttering service lines. But let me assure you, we're not struggling like others, we're actually growing. In full transparency though, for the past couple years and the foreseeable future, it looks a little rough. Wages and medical expenses are exceeding anything we've ever experienced. When our costs increase, we can't pass that on to the consumer like other industries. If you were to go to some other industry and they choose to raise their prices, they have the freedom to do that to cover their high costs and expenses. We have a fixed reimbursement rate from the federal government and from insurance companies. But overall, as an organization, we are doing well financially and plan to continue our growth. In fact, our growth includes investing in our own staff. This last year, we spent an additional $3 million of unbudgeted dollars in our team's wages and benefits. We're proud to do that. Our staff is the lifeblood of our organization. Our final and fifth strategic focus area is healthy community. And this is simply fostering a culture of health and wellness in our community and in the organization. And I'm going to have to talk about COVID. I really don't want to, and I know everybody's tired of that, but I need to talk about that for just a minute. It raises its ugly head every once in a while, and we still have to deal with it. To date, we've spent $13.5 million on COVID items that we had never anticipated spending. And we're thankful for relief funds that we received, but it doesn't cover the extended costs we are experiencing today or will experience in the future. This past year, there were mandates for the healthcare industry to be vaccinated, and we managed through all of that. And our staff is well positioned to care for our community. We navigated masks, we navigated the heightened anxiety of our community, and the staff is protecting themselves so they can care for others. Because we're tired of COVID, we did host a COVID Crush event at the hospital, and we had a great time. We smashed a car and took our frustrations out on the car. Other healthy community areas we're proud of is our continued support of the Doyle community. Our community care clinic got designated as a rural health clinic. That's a high bar for designation. Also, we just hosted our community health needs assessment this year, which gave us a roadmap for our community for the next 3 years. This was a collaborative community effort to gain an understanding of where we need to move. And let me give you a few notes of interest. The percentage of the community that is 65 years of age and older is 29.4%. Keep in mind that the state's average is about 16%. We're almost double what the state is, and because of that, there's a high demand for healthcare. We also rank from a healthy standpoint as a county. We rank number 92 out of 254 counties for health outcomes. Some of the areas that we struggle with are smoking and obesity and alcohol-impaired driving deaths and the uninsured. Let's talk about the uninsured. First, Texas ranks last for the percentage of people who are uninsured. And Kerr County exceeds the state's average for the percentage of people in our community who are uninsured. Through the Community Health Needs Assessment, there were several priorities that were identified. The mental health, access to care, healthy living, and much more. And to find out more about these stats and all about your community, go visit our website and find Community Health Needs Assessment there. Let me leave you with this note on our Community Health Needs Assessment. I'd like to challenge our community to be the healthiest in Texas. So let me wrap up with a few last comments and requests. Our staff at Peterson is seeing a rise in incivility towards healthcare workers. It's a national problem. The hatred and the physical attacks our staff is experiencing is unprecedented. Let me tell you a story that happened just last week. We had a nurse who had taken a patient to the bathroom, was caring for them. The patient comes out of the bathroom and asks to have a seat in the room. The patient has a seat and asks for the nurse call bell and cord. The nurse graciously gives the patient the nurse call. He drops it, and when he drops it, the nurse graciously picks it up and hands it to him. He jumps up, grabs the nurse call bell and the cord, and pins her against the bed and wraps the cord around her neck to strangle her. Thankfully, she was able to get enough leverage where she could gurgle out just help, enough that could be heard from the staff down the hall. The staff came running to help her and was able to get the patient off the nurse, and she's okay, but she was able to survive. That could have been devastating for our community and for the hospital and for the nurse and the family, obviously. That is unacceptable, and we need your help. One is to encourage those around you to act, speak, and be civil. It's all about kindness. Hold others accountable. And if you're seeing the same thing in our community or in your world or around you, then make a difference. Act different, be different. I'll use a quote from Mahatma Gandhi that states, "Be the change you want to see in the world." We need your help. We at Peterson are here for you. Our mission of providing exceptional, compassionate, patient-centered care is alive and well. To our team, I'm proud to work alongside of you and serve you. And to our community, thank you for supporting our staff and Peterson. We are looking forward to a great 2023. Thank you for listening.